So, Robin Rickines, can you tell me what your position is?
I'm the Director of Payer Relations in the Office of Managed Care at Johns Hopkins.
And how did you get into that field, that position?
I started out as the project manager for Medicaid Managed Care, and at that point all the contracts we were implementing were the Medicaid contracts, so it sort of made sense. I was the perfect person for the position.
That's great. So, where did you get this passion for healthcare?
I have to tell you, honestly and truly, the first course I took in graduate school, and I have to confess, my father did suggest, why don't you try this class? And it was love at first sight. I just loved the healthcare arena, I loved the policy arena, and the combination of the two.
So, in what way has your father influenced you in, the healthcare industry?
Well, I think honestly, I think that his influence was, I think, the whole focus on the patient. So, because he's always was very caring of others, and so to make the focus of what you were doing to be the patient.
And why is that?
I think that in terms of health policy, you really need to be in the trenches seeing what it's like to really understand and make informed policy.
What do you do on like a daily basis?
On a daily basis, the thing I've been in my job since 1997, and I always say every day is different. So it's one of those things I never really know when I come in on a Monday morning exactly what I'm going to face.
So take me through your journey. You first worked in an ophthalmologist's office.
Yeah, when I was in college, I worked in an ophthalmologist's office, and that was my first job in healthcare. Took care of the medical records, helped with the phone. I enjoyed it, but at that point, I really wasn't thinking that that's what I was going to do.
What was that second job?
The second job was I did an administrative residency at an HMO, right when HMOs were just beginning to expand. My administrative residency, I actually ended up staying there for a year, continuing to work on the service area expansion and all the regulatory filings for their service area expansion. And then I actually went to Washington, D.C., and it was a fellowship where I was a policy research associate in the Department of Health and Human Services in the Office of the Assistant Secretary for Planning and Evaluation.
You actually were, as you say, in the trenches.
Well, what was interesting was it was during Ronald Reagan's second administration, and it was very clear from a policy perspective as to what was expected. And I always thought that that was just the way policy worked because that was my introduction to real policy, that there was just a clear vision. But in retrospect, now I think it is that was a reflection of what Ronald Reagan's administration was like.
How many years have you been in healthcare, you could say?
Well, I'll actually have been in healthcare next year, 30 years.
Would you say that, healthcare is improving each year?
I don't think it is. I think that it's getting more costly, and we really, I'm not sure we're necessarily providing the best healthcare that we can. On the positive side, the amount of innovation and things that we've, learned over the years is amazing in certain areas. I think about just recently at Hopkins, they literally transplanted somebody's hand. It's amazing when you look at what we can do today versus what we could do 30 years ago.
What ways would you say, in your personal view, reforms that can happen in healthcare? Things that, all the problems that you see in healthcare,
Mm-hmm.
If it were up to you, how would you fix those problems?
That's a hard one. You know, it's easy to say that it could be better, and then the question is, how do you fix it? And I mean, I really do think that if you remember that the patient is the focus, because I'm not sure the patient really is the focus. When you look at how many individuals are employed in healthcare, it's a large employer. But sometimes I think people forget it's all about the patient.
Now, just in the past, I would say, around 5 to 6 months, you received bad news. Can you tell me about?
Yeah, I actually, and it's one of those things where you think, is it bad news or is it a wake-up call? And I sort of, you know, I always look at things, if something bad happens, there's always a good outcome of it. And so I did, I had got the word that I had stage 1 breast cancer. So, I mean, actually, stage 0 breast cancer. So, of all the breast cancers to have stage 0, I was very fortunate.
So, when you found this out, were you upset about it? What were the emotions that were?
You know, I definitely was upset. And it was one of those things where, you know, in healthcare policy, we talk a lot about the role of the primary care provider. And I really did go to my primary care provider, and he really was very helpful in grounding me in the reality.
And do you find that because of your position at Johns Hopkins that it did help you pave the way to getting good health care for your circumstances?
Well, definitely knowing, you know, how to work through the system was definitely a benefit, because easily I could have had my lumpectomy as much as a month and a half later if I hadn't been able to navigate the system.
But would you say that, you know, you do have a different outlook because of, you know, the, what is it, fortunate news you found out?
Well, I mean, in terms of, I do have an, you know, I think it's really, you know, even though I tried to put myself in, always in the patient's shoes, being in the patient's shoes does give you a very different outlook.
What were some of your criticisms that you have when you were a patient of healthcare, the administrative side and the policy side?
Well, one of the things that, as a patient, what I was surprised about is how sometimes really poor customer service on the front end staff, not the clinical staff, but on the front end staff, made such a difference. But it was one of those things where there's so much that falls upon the patient, you know, to make the appointments. And I'm fortunate. I understand healthcare. Mine was, you know, a stage 0. But think about the individual who is a stage 4 and is seriously, their health is compromised. You know, do they really have the wherewithal to be their own advocate? In my second day of radiation, there was a young woman. She must have been about in her 30s, I would say mid-30s. And she was actually close to the end of her radiation treatment. And I, as the new patient, was trying to figure out, you know, what should I be doing in terms of, you know, there's all this discussion about creams, you know, to make the side effects lessen and be proactive and all these kinds of things. And this young woman literally said to me, this specific cream was the best cream, and she literally took her shirt and showed me what the result of the radiation was for her. I mean, I was very fortunate. I have nothing but wonderful things to say about my doctors. My surgeon was wonderful. My radiation oncologist was wonderful. I'm just starting a relationship with the medical oncologist. But I still feel like, of all the things, that kindness of that woman to help me understand what radiation was going to really be like was definitely a big lesson and really made a difference in my care, to the point that when I was finishing up my course of treatment, there was another woman coming into treatment, and she was in the same shoes that I had been, and I did the same thing. I showed her what the impact of the radiation was for me, so she could actually see it rather than be afraid of it, and that also, you know, made the recommendations about the creams that would help her, and the things that had helped me.